Today on the signature evening, we shall be discussing the incessant strike by health workers, and someone will be doing justice to this conversation. And this is where Queensley will take over.
Okay, thank you so much. Our guest has always joined us via phone call to have a conversation on this particular subject matter. Our guest, Nurse Anumba Ogochukwu, who is the Secretary National Association of Nigerian Nurses and Midwives, NANNM, NOUT, NEWI unit. On our conversation is on the incessant strike by health workers. Good evening, Nurse.
Good evening.
Good evening, Ma.
Good evening. Thank you so much for joining us tonight.
It's a pleasure.
Okay, so the strike has been suspended. Um,
Yeah.
just before we dive into this conversation, with what has been read before by my colleague, these particular criteria, have they been met or it's in the pipeline?
Thank you for having me this evening. Good evening, Nigerians. The strike has not been called off. Rather, the strike was suspended. This is to enable the federal government to meet up with the promises they made to the nurses and the memorandum of understanding that was signed rather. The federal government through the Minister of Health and Social Welfare, Dr. Ali Pate, asked for a period of 2 to 4 weeks to allow the federal government to work on this. So we're hopeful something good is going to come up by the end of 4 weeks.
All right, nurse. It is really important that before the strike was actually suspended, what's the guarantee that this negotiation will be implemented? Because we know the likes of ASU that every time they go for one negotiation with the government or the other, and the next minute it seems like they're going back to square one. What do you think about the implementation of this meeting?
Every living soul, when a promise is made to a person, would always be hopeful that something good would come out of it. And that is exactly my stance. We're hopeful. But remember, I said earlier, the strike was suspended, not called off. We're holding them by their words, just like the National Deputy President, President of our association said they saw the sincerity in the Minister of Health, which made them to shelve the sword at the sword and come to a middle point where an agreement was reached. If that sincerity is not maintained by the federal government, we'll go back to our strike earlier proposed.
So would you say that the Nigerian government should actually adopt a separate wage structure for the nurses in order to avoid situations like this continue?
We advocate for that, and if properly handled, if positively handled, this will serve as a very good template for addressing future health problems in the health sector. So we advocate for that because as nurses, our duties are peculiar, which no other profession can do. Not the doctors, not the pharmacists, not the lab scientists and the hospital can take our place. So we advocate for that. Nurses spend more time with the patients. We are the closest to the patient than all the members of the health team. So we call for a different salary structure based on the peculiarities of our specialties and our duties.
All right, now let's look at the impact of this strike, especially on the vulnerable patients. You know, those that have appointments, they're supposed to meet up with the doctor and nurses, and those that the emergencies here and there. So far, with the days that the association went on this strike that was later suspended, what impact did it have on the patients?
Oh, it was the impact it had on patients. It's not something we can measure.
Mm.
Remember, the strike went on all through the federation, the 36 states of the federation, including the federal capital. And this strike brought the disruption in the patient care because there were no nurses to manage the patients in the hospital. There was no admissions. Delayed treatments, we had delayed treatments and procedures. Patients that were supposed to go for surgery had them cancelled.
Mm.
And you know, it somehow, for someone who would have gone for surgery and felt better, Between last week and now, a patient who went for surgery should be recovering and talking of discharge. But some had to be rescheduled. And there was increase in mortality and morbidity rate during the period of the strike because that gap which the nurses feel among the health sector is there in the health sector was left open. And apart from that, there was also for patients and for patient relatives, the economic impact was there because a lot of them had to source for funds to go for treatment at private hospitals, which we know would have required or would have taken more from them, where if they hadn't gone there, if the strike hadn't held. So the impact on the health system and on the patient and relative is not something that can be quantified. It's much. And this is an experience we don't pray to go over again as nurses in Nigeria.
Okay, so let's look at the poor working condition of hospitals in Nigeria. I'm sure that this is part of the terms that should be met with after calling off the strike. How would you assess the working condition of hospitals, the facilities in the hospitals, every single thing that entails the health sector?
On the positive, I would say that the strike drew not the public attention to the hospitals in Nigeria. It also drew the attention of the hospital owners, which is the federal government, to the situation of our hospitals in Nigeria. Speaking from experience, I trained in the north, had a program in the south, and now work in the east. At least I've been able to go through or go into some of our teaching hospitals to see what is obtainable there. It will be disheartening to know that most of our hospitals, the equipment to work with is not there. You would have you come across students who, in their years of coming for clinical experience or clinical postings, not being able to tell you what a vacuum pump is because they've not seen. You have some teaching hospitals where patients have to be referred out of the hospital to go for one investigations that or the other, which are very necessary and should have been done on emergency basis. So this is an eye-opener to the government and to the attention being called to it. The situation of our hospitals are so bad. A lot of hospitals are so deteriorated that you can't get simple equipment. So I call the federal government, this has brought the attention to it, and I just hope that they would work on it. It will be a facilitated thing to revive our hospitals and to make things work better, which every worker and every patient in Nigeria deserve.
All right, nurse, you just made this very serious statement now that some of the hospitals that these students, medical and nursing students that come around to learn and see some to see how things are done, they don't really have the necessary equipment, the advanced equipment to work with. Does this pose a threat to this generation and the ones to come for the nurses coming into the system? Since the Nigerian institution, medical health centers, mostly don't have this equipment to work with.
Yes, it does. It does. It poses a lot of stress, not just a lot, a great stress on both the nurses here working, the students, and the future nurses that will be working. Because we've come to a point where in the hospital you always hear us using this improvise. When this is not there, this is the ideal. Like when we teach our students, we tell them this is the ideal, that this is what you find in the clinical setting. So when you don't find the ideal, you improvise. And this makes a lot of nurses, when they go out to places where where they see these things, it makes them feel inferior, as if they've not been taught, as if they don't. The exposure is not there. Most times we read them on the papers, we read them on the books, we watch them in the movies. But when we come to our hospitals, it's not there. So it has created a lot of gap between our learning and our clinical settings, which does not really work hand in hand to get the best out of the workers and the students.
All right, then let's look at a lasting solution to this particular situation. How can the National Association of Nigerian Nurses and Midwives engage with the government to avoid strikes like this from happening in the future?
I'm sorry, I'll say this. This engagement has been something that has been ongoing. It will interest you to know that some of these things that the items we listed or the request we made, we itemized that in the agendas that led to the strike. Some of them have been something that has been ongoing for about 40 years. And before the strike came up, the nursing and the Nigeria Association of Nigeria and the National Association of Nigerian Nurses and Midwives, sorry, gave an ultimatum to the federal government, the 15-day ultimatum, which is about 2 weeks and a day before the strike came up. And we thought that within this window period, the federal government would have called the leadership of the association to a negotiation table to talk about this thing. But they didn't come forth. That was why the strike came. I think if the federal government really wants to do the needful, there are ample opportunities. Set the board, just like the nurses we are advocating for. Let's have a good and a fair representation of the association in the board of the tertiary hospitals, thereby presenting our needs as nurses. This is what is needed. This is what we do. We know our problems and we know what we want. Present these things. The federal government look into it and take care of them. This strike wouldn't call up. As a person or as an association, we're not happy that the strike came up. And if the federal government will keep listening here to us and to other professionals, I think these things will be called up. It will be stories of the past and we'll have a better healthcare system.
All right, nurse, what are those indices or should I say mechanisms that can be put in place should the National Association of Nigerian Nurses and Midwives go on another strike? Let's say the government does not, agree to their own terms of the conversation they had with you before you guys suspended the strike. What have you guys put in place to manage the situation? Because at the end of the day, this is looking like two elephants fighting and the grass suffering from it. Because the vulnerable patients, the elderly patients out there that have nothing to do with the government not responding to agreements will be the ones to suffer and die in the process. What can be done or put in place, to preserve the cases of deaths while this strike may likely be going on?
What can we do? That's a question, $1 million question. As an association, there's nothing we can do. Our hands are tied. Remember, we are under the employment of the federal government. We are paid workers. We come to work. We do that which our profession, which we are licensed to do within the jurisdiction of our learning and within the law. Which is if we have anything to do, our hands are tied. We can't help out. That is just the truth. If it was something which we would have done as nurses, with the kind of hearts we have to work and the kind of heart we have in caring for our patients, we will do it. So the whole thing lies on the federal government. Since they've agreed to do this, to do what they've agreed to do, and we get working. There's no nurse that enjoys being at home. There's no nurse that enjoys coming to work and not seeing the necessary materials they need to work. So we plead with them to do what they should do within the stipulated 4 weeks, which they agreed to. And we will be happy working.
All right, thank you so much.
Okay. So some of the demands for the warning strike to press home their demands was which included an upward review of shift allowance, adjustment of uniform allowance, and a separate salary structure for nurses. The demands also include an increase in core duty allowance, mass recruitment of nurses, and the establishment of a nursing department in the Federal Ministry of Health, among others. With all these things, we know that the government of Nigeria might not really tick all the boxes for this particular list. So if peradventure some things are being met, would you like place some more importance than the others, or all of these things are on the same level of importance for the nurses?
All these are so important to us. All are so important to us. When you look at this, it's only one of the demands that requires financial implication as far as the nurses in Nigeria are concerned. The gazetting that we'll ask for is something that was agreed, that was approved in 2016. And from 2016 to 2024, we're talking of close to 10 years now. So that's the federal government should do. The implementation of the court, the judgment that was had for the creation of nursing departments should be done. The centralization of interns should be done. Fair representation should be done. So all these things are something that the federal government can do. The allowances, we look forward to that. But for the separate salary structure, the president of the nation has told us that they are putting on something on ground for a single salary structure for each department. So we're looking forward to that. But apart from that, every other demand is legitimate, and we hope.
Okay, so
and
why?
are so hopeful that they will come to pass.
All right then. So why are the nurses bent on the separate salary structure?
We are not really bent on it, but we did it.
Okay.
We need it. If I should use your term, bent on it means that if it doesn't come, we're not working. But we're not taking it to that extent. While we're asking for this is that we're in Nigeria, and when you go through the public service rule, you'll find out that apart from the men of the fire service, nurses are the only authorized personnel to attempt to receive uniform allowance from the federal government. While from the fire service receives 30,000 per annum, nurses are to be paid 20,000 per annum. And this has been for long. And in Nigeria today, 20,000 cannot give you a complete set of uniform. While other associations or other professions, who do not use uniform, who don't go on uniform, or who are not known to use the uniform, advocated for and got 100,000 per annum for ward codes and all that. Why can't things be done for nurses, or more for nurses who use this uniform as a means of identification and each shift? So we need it. And the shift allowance, it's necessary. Nurses put in a lot to work. Even like when you're at work, you as a nurse, you work as a nurse, you work as a counselor, you work as a cleaner, you work as a lawyer, patient advocate, you work as a security, we do a lot of things in a shift. So this salary structure which we're asking for, it's legitimate. We need it. And it's the rightful thing that should be done to us.
All right. Thank you so much, nurse. This very question, some sector in Nigeria are experiencing privatization. We have the likes of electricity and the likes of refinery. Even the Nigeria NNPC considers selling the refinery, and also different angles. Do you think if these federal hospitals are privatized, this will be solved?
It wouldn't solve the issue. It wouldn't. It wouldn't. Yeah, I know why I'm saying this is that when you privatize, it's just like you're selling it out. It automatically becomes a private institution. And when it becomes a private institution, the manager will be out for profit. Whatever that goes on, it's none of their business. All they will be out for is for profit, what they will earn from it. Just like the electricity sector. You buy your airtime or your utilities. When it's done, you stay in darkness. If it becomes privatized, we go back, it becomes as good as a private business. Nigerians would suffer. The cost of health sector would skyrocket. And a lot of Nigerians will find it difficult meeting their health needs. So going for privatization is not something I encourage. It's not something I advise. It's not something I advocate for, and shouldn't be done. For the sake of the masses, it shouldn't.
All right. Thank you so much, Nurse Ogochukwu. Thank you for joining us tonight. And we hope that the federal government meets with the demands of the nurses.
Thank you very much. And we're hopeful and really pray they do.
All right. Thank you so much. Hopefully we'll have you when they do to know exactly the demands that they actually head out for you guys. Thank
you. Save Nature TV. News in your pocket.